Hello, this is a video tutorial on helping you to become a proactive reader of the introduction section of your own journal article. Before we begin, let's review what you've already learned in the program in terms of essays and the structure of the introduction paragraph. Let's use that information to help become an active reader in the introduction section. Why? Because shortly you'll see that they're actually quite similar in the way that they're organized. Okay, let's begin with our review. So, a funnel-shaped introduction. You may recall that the introductory paragraph of an essay begins with some kind of hook or attention getter, which is some kind of statistic or an anecdote you learned, and then it proceeds to background information. And as the background information gets near the thesis, we get more specific. We narrow the topic until the thesis statement. Well, did you know that the same funnel shape is true for the introduction section of a journal article? The authors will begin with some definitions about the condition that they're investigating. Then they'll move to some background information about the prevalence of the condition and the impacts that the condition has on the people who have it, or maybe the healthcare community. Then, becoming more narrow, the researchers will begin to talk about studies that are related to their own study's research question. So they'll give background information on related studies, what other experts with the same specialty have to say, and then they'll identify the gap, meaning a contradiction in the research or limited research on a particular question. So, after they identify the gap in the literature or the gap in knowledge or research, the researchers will state the aim of the current research study before they say what their research question was. So the research question is very similar to the thesis statement of an essay, in that the research question controls the whole article. So, how is this helpful? Well, if we know that the introduction section begins with some general information about the condition, maybe some statistics about how prevalent it is. It could be some associated risk factors or current treatments or impacts on the patient or society. Then it moves more narrow to related research, identifying the gap before stating their own specific aim and research question. Then we know where we can find what types of information. So, let's compare the organization of the introduction to how you'll take your Cornell notes, what you should be looking for. So for the background, you can see that you should begin to take notes on what the researchers already know about the condition. That could be the condition definition, the prevalence. How do you pick and choose what to say in this part? Well, focus on the research question. So in other words, about the research question, what do researchers already know? What don't they know? What is the knowledge gap that they are trying to fill? And why is it important that they are attempting to fill this gap? Then, as you move towards the end of the introduction section, very clearly the researchers will state the aim or the purpose of their study, and they will clearly state what their research question or questions are. If you have a random controlled trial, they might even say what they expect the results will be, which is the hypothesis. Okay, knowing that the introduction section is shaped like a funnel and knowing what notes you should be taking, it'll help you to locate the key information. Don't highlight everything. Select what you highlight based on the research question, the gaps in knowledge. That should help. Okay, if you haven't already highlighted the sample article, go and do that now. Pause this video and come back when you're ready. Let's compare our highlights. See you soon. Okay, welcome back. Let's compare. So, highlighting information about the introductions section that moves from general to specific. So, in my highlights, you can see in yellow that the authors began by giving a definition of what postpartum psychosis is, referred to as postpartum psychosis. You can see here's the definition and when it occurs. You can also see general background information about prevalence and some background information about the symptoms. We can also see information about some of the effects of postpartum psychosis on the mother-infant bond, and on the family. So in yellow, we get that background information about the condition, we get a definition, prevalence, we could get symptoms, perhaps even risk factors, and what the impacts are. Then the authors will move to related information about their research question. Now, you may recall that their research question, the aim, here in the abstract, our aim was to understand women's experiences of mental health care services. So they're interested in treatment. Okay, they're interested in the services that women receive. Okay, so let's see how this introduction becomes more narrow and focused about treatments and services. After we learn about the condition, I've switched here to green just to show you how the information begins to get more narrow. So, we can see that we're now getting background information on the treatments or the services that women receive, because this is related to what the investigators want to learn. So, they begin by saying that early and effective treatment are crucial, and they cite the different experts. They also say that mother and baby units, or MBUs, which allow the mother and the infant to be admitted together, that's considered best practice by experts. We have another citation. However, we learn that the MBU, the mother-baby units, that they're not available everywhere. And so we're beginning to get related to the research problems. So these MBUs are not available everywhere, and also about the treatment, that some women are admitted to psychiatric wards without their babies, or they're treated in the community. So we're getting more information about treatment, and you can see the citations. The researchers move from the general treatment, related information, related studies, to the gap. And we can see language like there is conflicting research, in this case, there has been limited research that explores the experiences of women who are treated for PP. For example, one study found that women are often dissatisfied. Other women are frustrated. You can see the different sites. We also learned that it's distressing, and that the women also say that it doesn't meet their needs. So, this is the gap, that there is limited research, even though we know that there's a problem in how the services are being delivered to women. Okay, after the researchers discuss the gap, the next thing they'll do is they will mention the aim of their own study, and also they will clearly state what their research question is. Remember, that's the guiding question for the whole study. So, let's take a look. Okay. In the current study, we aim to address this gap in the literature by exploring how women with PP experience services and support, and what kind of care they prefer. Okay? There we go. Stated clearly. Okay? I'll underline that again so that you can see the language involved. So, in the current study, we aim to address this gap in the literature about treatment, exploring how women with PP experience the services and support, and what kind of care they prefer. Why? Because so far, few studies have used a qualitative design to explore in depth women's experiences. So this study, they want to do a qualitative, which means recording lots of descriptions. A qualitative, in depth. Learn about women's experiences of the service that they received. What are the gaps in the service? What needs are not met? So, number 1, the qualitative design is to explore how women experience the service. And number 2, our second research question, what kind of care they would prefer. Okay, what we haven't answered is why this is important. Sometimes that information comes before the research question, when the authors describe the gap, and sometimes it comes after. In this case, it comes after. They'll state clearly why it's important. So, this kind of study can contribute to improving the service and developing models of specialist care for patients with the condition. Why? Because that will help improve the outcome. So here we have the aim, we have the research question, and we have why it's important. Okay, to review what we've done. Basically, we used our knowledge of the funnel design to get basic information about the condition, such as definitions, prevalence, symptoms, maybe risk factors, impacts, and how do we pick and choose what to write in our notes? Well, we relate it to the research question. In this case, because the research question was about treatment, we can include some of the related studies and the related information about treatment. Now, for your own study, scan towards the end of the introduction for the research question. What was the purpose of the study? What was the aim of the study? Knowing that can help you focus what information in the background to record in your notes. Okay, good luck.